Right, you're watching TVC Breakfast. Let's get to our next discussion of the day. One of the most common infectious disease is no respect of any person is malaria. Now, the World Health Organization records that every 2 minutes a child dies of malaria every year. More than 200 million new cases are reported. And now with its devastating impact on families and communities, there is need for the deployment of new tools to fight against this disease while educating people on how to prevent it. Today is World Malaria Day, and this year's theme, Harness Innovation to Reduce the Malaria Disease Burden and Save Lives, aligns with a call to urgently scale up innovation in the fight against malaria while advocating for equitable access to malaria prevention and treatment. So this is the crux of our discussion next. And joining me via Zoom is a public affairs physician, Dr. Anire Chima Oduku. It's good to have you join me this morning, Doc.
Thank you for having me. I'm glad to be here.
All right. Now, let me start it this way. It seems malaria is the most popular disease that anyone can have, especially in this part of the world. There is virtually no one around who hasn't had malaria at one time or the other. But as popular as this disease may be, and as well as the agent that causes it, we still haven't mastered how to prevent malaria. Talk to us from there.
You are very right about how common malaria is. Malaria is it's prevalent, meaning it's one of the diseases that we live with here in Africa, especially Nigeria, because of our environment. We are in the tropical region, and the environment is very conducive for the vector, which is the mosquito, to thrive. So yes, it is very common. However, I wouldn't say it's completely right to say we've not mastered prevention. We know what to do to prevent malaria. The problem is people are not doing it. People are not adhering to the instructions or to the recommendations given. But as many as do can prevent malaria.
All right, so let's go there. Let's go there directly to the issue of preventing malaria. It may be elementary, it might be simple, but how do we prevent malaria in real terms?
Okay, so there are many strategies to prevent malaria based on what we know of what causes it. The vector, which is the mosquito, and how it multiplies and all that. So taking from there, from our own aspect, from a personal aspect, one of the ways to prevent malaria is using an insecticide-treated net. So sleeping under an insecticide-treated net. We know that most bites of the mosquito that cause malaria occurs at night when a person is asleep. So if a person can sleep under an insecticide-treated net, the risk for being bitten by the mosquito that causes malaria will be reduced. So that one is a very, very effective strategy. Then indoor spraying with insecticide is also quite effective to kill them. Although research is showing that a lot of these mosquitoes are becoming resistant to the insecticide, it still works, although there's increased resistance. So doing that can prevent malaria. Then we also have chemoprophylaxis, use of drugs to prevent malaria. So we know that some of the people that are at higher risk for malaria are children under 5 years old, pregnant women, a traveler coming from a region where malaria is not prevalent and then coming to targeting those people for chemoprophylaxis, for drugs that can prevent malaria can help. So for pregnant women, there's already a strategy that makes sure that they have 2 doses of a certain type of drug. So that can prevent malaria. So yes, even in children, there are drugs you can give them. Like some people call it Sunday tonic, and other drugs. Just meet your doctor to prevent malaria. So we can do that. So that's at the level of drugs. Then environmental care, keeping our surroundings clean, emptying the gutters. They like stagnant water. So when the gutter is flowing, it's clean. you destroy their breeding sites, destroying vegetations, overgrown grasses. Using insecticide also to destroy the larva before it grows. So these are some of the preventive measures, targeted environmental care that can prevent malaria.
All right, let's talk about the prevalence, or how susceptible children and babies are to the malaria. Now, the point there is, comparative to adults, babies and children, the cases with them is more critical. Now, talk to us from the window of preventing malaria in children, precisely, and also the issue of talk about the issue of malaria vaccines in places like Malawi that has been tested very successfully.
Okay. So, like I said before, one of the most effective ways of preventing malaria for children is making sure they sleep under an insecticide-treated net. That alone can reduce new cases of malaria by a very large percentage, sleeping under an insecticide-treated net. Then we know that there's a new vaccine called Mosquirix. It has not yet been rolled out in Nigeria, but it's available. It's being used in Ghana, in Malawi. And it has shown that it can prevent severe forms of malaria. So in children, because of their physiology, malaria tends to affect them very fast, such that it rapidly deteriorates into something critical over hours. So a child can just come, have the symptoms, and within 2 or 3 days, it has deteriorated into, and that's why most of the deaths of malaria occurs in children under 5 years, and also other people that have lower immunity. So the use of the vaccine is very promising, shows promising results in reducing drastically deaths from malaria. So research has shown that it might not prevent malaria from occurring, but it will reduce the severity of the disease in children. So like I said, right now it's already been rolled out in some other places in Africa like Malawi, Ghana, but it has yet to be rolled out in Nigeria, so we eagerly await that. And we are hopeful that when it comes, it can improve the prospects and for children.
Okay, now let's talk about the issue of fumigation, for environmental fumigation against malaria. You mentioned the issue of dirty environments earlier on and all of that. Now, this reality is very prevalent in many of the societies that we live in our cities. Now, how effective is the issue of fumigating a whole city or a whole community or a whole street against malaria?
Well, it will go some way, but without cleanliness, environmental sanitation, making sure that, because we cannot just fumigate once and go. When you fumigate at that one point, it could kill some of the larvae that are there. However, the conditions to make them grow again are still there. So it's not a one-time just fumigate and go. It's an ongoing measures of making sure that the gutters are cleaned, the place is kept clean regularly. Then the fumigation can have some effect. But just fumigating one-off and going will have limited effects, because the conditions for the mosquito to still grow are still there. I hope that sheds some light on that.
Yeah, of course, it sheds a lot of light. Of course, one is also seeing the possibility that it could also be very expensive to have that done continually for a period of time. Now, let's talk about the issue of the theme. The theme for this year, World Malaria Day, focuses says harnessing innovation to reduce the malaria disease burden and save lives. Now, when we talk about innovation, because you mentioned earlier that some of the incidences or cases are becoming resistant to malaria drugs. What kind of innovation should we be looking and expecting at this time?
Okay, so we should be expecting research that produces new agents that the mosquito is not resistant to. So new agents, new insecticides, when we're talking about innovation, we're also talking about how to diagnose, tools to help us diagnose malaria fast. So far, there have been some improvements in the past, which normally they used to go to the laboratory, and use microscopy to diagnose malaria, which is still the gold standard for diagnosis. But now we have the rapid diagnostic tests, which can be used in rural areas. So the problem with microscopy is that it has to be done by a skilled professional. But with the rapid diagnostic tests, anybody really can diagnose malaria. So those are the kind of innovation we are talking about. And one of the things that kill children is when there's a delay in diagnosis. So a child has fever, has headache, and the mom keeps giving paracetamol, or they're not sure what it is. But with tools like a rapid diagnostic test, even in the rural areas, in the village, they can quickly run a test, and then you find out that it's malaria and start treating. So those are the kind of new innovation we're talking about. New tools, new research that shows new insecticides that can combat the vector. The insecticide-treated nets was a new innovation that helped to prevent the bite of the mosquito, but we need new ones, other strategies, newer drugs. So yes, we have the artemisinin combination therapy now used in treatment. Before it used to be chloroquine. I know in the past you knew it was chloroquine that used to be the drug, but we don't use that now. So research showed new drugs that are effective, because with time, we expect that even the parasites will become resistant to these new drugs, but we don't have any new ones in the pipeline. So these are the new innovation we're talking about, new tools, new ways of diagnosis that are faster, new treatment regimens, new vector control measures. Okay. And probably, maybe, I don't know, innovation. Someone needs to come up with, okay, is there an app we can use? The world is gearing towards technology now for everything. How can we use technology to harness treatment for malaria and prevent it? How can we use, so what are the new strategies? So these are the innovation we are talking about.
Okay.
In my understanding.
All right. Now, you've talked about the issue of resistance for some time. What really leads to a situation like that, where drugs that are known to have efficacy against malaria, after a period of time begin to, there's a resistance against them where they no longer work as they used to? What leads to a situation like that?
Okay, so again, it's multifactorial. There are many factors. First, you can look at it from the level of the parasite and the vector. So it happened with COVID, where new strains are forming that are becoming resistant and are becoming stronger. So they also adapt. Their genetic makeup also adapts to situation. So when they also want to survive. So when you use the drugs, the treatments, yes, it works. But with time, even the parasite begins to adapt so that it can bypass how the drug works. So number one, genetic adaptation of the parasite itself, adaptation of the vectors themselves to become stronger, more resistant. One of the characteristics of living things is adaptation. They can adapt. So that's one. Number two, from the point of view of human beings, there's a lot of drug abuse. Like I said, drug abuse, that's why one of the strategies for treating malaria is that you must be sure it is malaria first. So the recommendation is that every suspected case of malaria must be confirmed with a test. And that's why rapid diagnostic test is such an innovation. And that's why I talked about it. So most times, most people just assume, they just have symptoms, they just have fever and headache, and just assume I have malaria, and then they just go and take any drugs they like and just use it. And it might not be malaria. There are many causes of fever and headache, 100 of causes, but people just assume it is malaria. So when you now use the drugs when it's not malaria, you are also leading to resistance. And then improper use, improper dosage, Okay, so all these things can lead to resistance.
Yeah, in fact, when you mention people taking different medications on their own, it's really common in our society around here, where people just, they feel they have headache and they just go to a chemist or a pharmacy to buy drug and so on. It's very common. But talk to us about, on a day like this, how best can we commemorate World Malaria Day today? What should happen today? What should we expect on a day like this?
Well, number one, TVC has kick-started the process by having conversations about this. So World Malaria Day, we are putting on the spotlight on malaria, telling people that it's still a problem. We should know that in the past, in between 2000 to 2019, there was a reduction in new cases of malaria, but after COVID, it has increased. So we need to know that. So talking about it is one of the things we should do. Advocacy is talking to people that can make a change. So we need more commitments from our leaders on malaria treatment, prevention. So everything begins and ends, but everything is dependent on funds. So we need more funding. It's funding that will enable there to be rapid diagnostic tests. It's funding that will enable there to be a lot of drugs that can treat malaria. Then also, there needs to be universal health care. That is a key strategy, because a lot of people do not even have access to health care. So when they are ill, where would they go to get their treatments? So that's a key step, universal healthcare, where everybody, not just those in the cities, those in the rural areas, the marginalized, the vulnerable in society, have access to healthcare that will not drive them to financial ruin, that will not make them use all their money and become broke and bankrupt. So yes, strengthening our health systems to be able to accommodate everybody that comes, so that when people are ill, they know, okay, we can go to the hospital, so they don't start treating themselves at home. So those are some of the things. So putting more emphasis on malaria, letting our government know that they should do more funding, more political will to eradicate malaria.
All right. Now, this self-medication, because of how popular it is amongst our people, can you talk more? How dangerous is the issue of self-medication? Because sometimes people go to the hospital at first, and then maybe they could get the regular diagnosis, and then they're given certain drugs and so on. And then when they fall ill again, instead of going back to the hospital, they just feel the same drugs I was given the last time, I can just go to the pharmacy and buy them. And since it's the same way I'm feeling. But talk to us basically how dangerous that is.
Okay, so self-medication is very dangerous, so dangerous, because the truth is, you are not sure what it is. You just assume. A lot of diseases present in similar ways. And one of the ways to combat disease is combating it early. So if you want to have a very good prognosis, you want to be cured well, doctors are not magicians, that's the truth. One of the ways to make sure you are well is that whatever it is that is wrong with you is diagnosed on time. So when you take the wrong drugs, you feel that this is what it is, and you are delaying the time of diagnosis, such that, and then you now go to the hospital towards the end. And so number one, it's not safe for you. You are reducing your prognosis of whatever is wrong. Then how do you know that the dosage of what you are giving is right? You treating yourself can also contribute to resistance, which is another problem, microbial resistance, which is another problem that we are fighting. A lot of drugs are not working anymore, and there are no new drugs in the pipeline. So this is not about malaria per se, but another thing that a lot of people use is antibiotics. They abuse antibiotics, and there are no new antibiotics in the pipeline. So when you keep doing this, when you have a real disease that requires those drugs, including malaria, it will not work. And if nothing is working, we don't have any new drugs. I don't want to say what will happen, but it may lead to death. So we need to educate people to stop that practice of self-medication. Go to the hospital. And another reason why people might not want to go to the hospital is funds. And that's why I say one of the things is make universal healthcare available to all. Let people know much money or not. So that can also deter the practice of self-medication.
All right. Dr. Anire Chima Oduku, thank you so much for your time and all the enlightenment today. Thank you for your insight.
Thank you for having me.
Great.
Thank you.
Right.